Abilify and its effect on neurotransmission. Abilify is a drug known as an antipsychotic. But what exactly is Abilify? Abilify, also known as aripiprazole, and other antipsychotics are drugs used by individuals with psychotic mental disorders, such as bipolar disorder, manic depression, and schizophrenia. In some cases, Abilify is used to treat temper tantrums and self-harm related to autism in adolescents. How Abilify works. Abilify works by changing the action of chemicals in the brain. Unlike other antipsychotics, which shut down dopamine receptors, Abilify acts by making the receptors work properly. It can either activate them or shut them down when there is a deficiency or a dopamine surplus. Neurotransmission. What is neurotransmission? Any one of a number of chemicals that are used to transmit nerve signals across the synapse. Neurons are either active or inactive in one's body, most being inactive. Signaling molecules called neurotransmitters are released by a neuron in the synaptic cleft and bind to and activate the receptors of another neuron. Before their release, inactive neurons are set at -65 millivolts, which is called resting potential. Eventually, after neurons reach an action potential of -60 millivolts and achieve a firing threshold, the neurotransmitter is released to the presynaptic terminal. Released neurons are either excitatory or inhibitory, which means they make a cell more positive or negative. If positive, the cell reaches its action potential. This is where Abilify comes into play. When Abilify gets into one's system, neurons released in the synaptic cleft modify dopamine levels by enhancing them when there are insufficient amounts, which causes depression, or by inhibiting them when there are excess amounts, which causes schizophrenia. It either lessens or increases dopamine activation. The arrow pictured signals the postsynaptic neuron where dopamine activation is either made more negative or positive by Abilify. That means it either activates or terminates dopamine. This activation control is what relieves symptoms in patients with psychotic disorders. Dopamine levels are either increased or decreased, partially slowing down what causes their psychotic disorders to tick. A review. Abilify has been proven to reduce symptoms in most of the patients who try it. It does not work for everyone, like most medications, but has been proven successful in reducing the symptoms of those with psychotic disorders and helping them live a more normal, manageable life.
Created using Powtoon.